And so we've been having fun here for about the last 10 minutes, but now it's time for us to get going. We have some great guests with us today, Raquel Roos and Brianna Duncan. Sorry about that, Brianna.
It's okay.
Second name. But we're happy to have them here today to talk to us about their multidisciplinary practice, which I think is a really important topic. I actually was going to try to look up an old article that I had read some time ago about interdisciplinary practice as a little bit of an entree to your discussion today, my Get Smarticle, as it were. So we usually do a Get Smarticle at the beginning of each session. Today, I'm not going to be able to do that. I'm going to make apologies to the group. And I have had a fairly good excuse because I've had COVID-19 for the last 6 days. And so I've had to be in a position of recovering from that. And also yesterday, getting my monoclonal antibodies treatment, which was quite effective. I was just very happy with the results of that. And so, I was reflecting earlier that it was interesting to have had the experience of working with COVID-19 for all these many months that we've been working with this problem, and then experiencing actually having it. It's certainly not something that I think anybody wants to do, and you should do everything you can to avoid that, mainly getting vaccinated. Also, if you do get it, to utilize that monoclonal antibodies treatment, which is very effective also for knocking it out. And so I really encourage people to think through that if they do get it. And so with that, though, I'm going to go ahead and get us into our topic of the day. And as I said, our guests today are Raquel Roos and Brianna Duncan, and they are here to talk to us about their multidisciplinary practice. So thank you so much for you guys being here today.
Thank you. Yeah, so do you want me to go ahead and get started?
Well, can you take just a minute and introduce yourself?
Yeah. So as he said, I'm Raquel Roos. I am one of the part owners of Mobile Therapy Centers, which is what we'll be talking about today. I'm also a BCBA, so a board certified behavior analyst, and the national director of ABA services. And Brianna is my coworker. Go ahead, Brianna, you can introduce yourself.
Sure, I'm Brianna Duncan, also a BCBA, and I'm currently serving as the clinical director of Tennessee. So Raquel and I do a lot of talking, and she'll talk more about how we started in Illinois and now we're branching off to Tennessee. So I'm the feet on the ground here, building an awesome vision.
And Brianna, this is not your first time being on CCN.
No, I presented, I think a year and a half ago, maybe, about building rapport and buy-in with DSP workers.
Right. And that was not your first time either, though, was it?
Well, I think I presented individual cases when we were a little small, or the Encouragement Network on site.
Oh, okay.
At Harold Jordan. So I've been here since the beginning, I think, but I haven't tuned in that often.
Yeah, I was just trying to determine if you needed to be part of our 5 Timers Club.
Sorry, what was that?
We have a 5 Timers Club. So
oh.
Yes, I'm here 5 times.
Okay, well, I think I'm at 3. So we have some cool topics. We might come back.
Yeah. Now, with that, I want to make sure y'all didn't not get informed that you are to provide us also with an interesting fact about yourselves.
Bree, you go first.
Okay. I think I might have used this a year and a half ago, but something that's interesting that I like to do is mine for quartz crystal. I feel like that's a fun thing I do. So out in Arkansas, you can go out into the mountains, bring your shovel and a lot of buckets, and you can find some beautiful crystals. So you just kind of pay for a pass to go on someone's property, and it's a lot of fun. It's like being a treasure hunter.
Oh yeah, if you had given that fact before, I would have remembered that.
Oh, okay.
You're a quartz miner.
Yeah.
Okay. And they have a lot of that in Arkansas.
Arkansas is the primary place I've gone, yeah.
Is it the Diamond State, or it's got something they have?
Yeah.
There's something. Okay.
And they have quartz is the most predominant stone there, so clear quartz, and it's a lot of fun because if you go real deep, you're finding stones that no one has ever, touched or saw, and there's some really clear ones. So it's a lot of fun.
Jennifer Johnson Pike corrected me. It's the natural state. But I do recall that they do have a lot of precious gems.
It's a lot of fun. I highly recommend it. If anyone needs to know the best spots, let me know.
Okay, definitely will be giving you a call. And then Raquel, how about your interesting fact?
Well, it's not as interesting as Bree's. Mine is just kind of a personal thing. So everyone in my family has the same initials, so we're all RRR. And then I actually ended up marrying someone with those initials too, so which was kind of crazy. Everyone thinks we planned it, but we didn't. And then we had a son recently, and he has the same initials as us too. So now it's just become kind of a thing. It's kind of weird, kind of cool, but we're all R's. So that's my.
R.R. Tolkien was part of your family. Okay, trying too hard there. J.R.R. Tolkien, but yeah. Okay, so y'all are the RRs. That is an interesting fact.
I know, and it's my first cousins on one side all are R's too, and none of the names are the same, so it's kind of crazy.
Well, that's cool. So
Yeah,
RR.
My next child, we're not continuing it. We're gonna use a different letter, so we've run out.
Well, RR, with that, take it away.
Yeah. All right. Well, thank you guys. I am going to share my screen. I have a PowerPoint to show you guys. Let me see. Okay, let me know when you guys can see the PowerPoint.
Good to go.
Able to see it? Okay, awesome.
Yep.
So mobile therapy centers, we actually started out in Illinois 15 years ago. There's 3 owners. So the primary owner's name is Jason Newman. He was a single dad at the time, and he had a son that was not speaking. He was, went to a birthday party with him. He was the only child that wasn't able to play and socialize, had a big meltdown, and that was kind of his breakthrough moment as a parent that said, I need to get my child some services. Since he was a working single parent, it was really hard for him to find a time slot for his son to get speech therapy. So he created this mobile concept where therapists can go to his son. They can go to his daycare, they can go to his home when it's convenient for them as a family versus being on a wait list, for the after school time slot for months and months and months. So he created mobile therapy centers, and then me and Nicole Fauquier. Nicole is a speech pathologist, and I am a BCBA. We joined in, and we added on, so we have speech therapy, occupational therapy, feeding therapy, counseling, and ABA therapy. So we're completely multidisciplinary. Oh, and the one I forgot is actually physical therapy. We just added that this year. So we're completely multidisciplinary, which is super unique in our field. Typically in the ABA space or applied behavior analysis, you're not able to also provide those other disciplines. It's a lot of companies, say that they have it, but they might just have 1 staff member or 2. We have a whole department of speech language pathologists and occupational therapists and feeding therapists. So it kind of makes us a unicorn in the field, which is super cool. And you'll see on some upcoming slides what makes us unique. So like I just said, oh, sorry, I already said this. Here's all the services we provide. We have clinics. So specifically in Tennessee, we expanded out there last February. We saw a huge need out in the state of Tennessee, lots of kids that were not able to get services because of the wait list. So we saw, the need, and we went there. We have a clinic in Clarksville, Tennessee, and in Franklin, Tennessee. And then we also do in-home therapy as well as going into schools and daycares.
This might be too early to ask this question, Raquel, but as it relates to the payment for these services, is it done through insurance or is that done through private pay? How do folks pay for these services?
Yeah, so we do a mix. We do take private insurance. In Illinois, we only take private insurance. In Tennessee, we do have, TennCare clients too. We do private pay. It does get pretty pricey for families, so I would say that's probably, we only have a handful of clients that do that, but it is definitely available. And yeah, feel free to anyone just interrupt me as I go. I can't see you guys as I'm presenting, so just interrupt. And then Bree, just chime in whenever you feel you need to.
Yeah, I just saw a question that asked if we also do TRICARE, and we do. So if we notice down in the chat, do you want us to go over that, Bruce, as they come up?
Well, I tell you what, if you want to, you can wait. We'll periodically jump in and handle the questions, but
Okay,
it's great
cool.
to go ahead and answer these questions that are up so far.
Okay.
Why don't we just go ahead and answer these, and then we'll proceed from there. So question one was TRICARE. Brianna handled that one. Do you serve adults?
Yes, we do.
Okay.
We primarily, so our clinics are pediatric based, but we do in-home services for adults.
Okay, excellent. And then what therapies are done in home? ABA, speech, any others?
All of them. So we can do anything that we can do in the clinic, we can do at home. So it works really well for kids, especially busy families, working parents, siblings, things like that. So a sibling can get a therapy session while their brother is getting ABA or something at the same time.
And handling all the questions up to this point, do you work with TEIS, Tennessee Early Intervention System?
So that's something me and Bree actually just touched upon. So we do. We are in the process of becoming a provider through them, but we are, yes, we're in the process of doing that.
Okay.
Yep.
And I'm going to ask another question here because somebody just popped this one up there. Do you have therapists who speak Spanish?
We do.
Okay.
We do Spanish and English, and then any other languages. If different insurers do allow translators, so that is something that we are open to as well.
Okay. I'm going to give you the chance to move on right now, and we'll come back and handle some more of these questions.
Okay. And then I don't know if you guys, I can't see the questions, so do you guys mind if I just keep my screen as the PowerPoint and you guys can just interrupt me as needed?
Oh, yeah. Yeah, absolutely.
Perfect. All right. So ABA also stands for Applied Behavior Analysis. Typically, this is what everyone knows as therapy for children on the autism spectrum scale. However, you can use ABA with other diagnoses too, such as Down syndrome, developmental delay, things like along the lines of that. It's taking a skill and breaking it down, and we reinforce completion of those steps. So we can work on things like getting dressed, going to the dentist, potty training, play dates. These are just some of the things, not all of the things. Pretty much anything that a child is struggling with, we can apply ABA to and help them work towards that goal. Speech therapy, so this specializes in speech and language development delays, so we can work on feeding sensitivities, articulation, auditory comprehension, language expression, fluency, social communication, literacy skills, and executive functioning. In occupational therapy, we can work on fine and visual motor and sensory processing delays. A lot of our kiddos on the spectrum also have a lot of sensory needs, so that's why this pairs well with OT or occupational therapy. Fine motor skills, gross motor skills, motor planning, sequencing, strengthening, body awareness, bilateral and bimanual skills, regulation and coping strategies. Sorry, that's all supposed to be one bullet at the end. But those are just some of the things that we can work on. A lot of, one thing I should mention about MTC, mobile therapy centers, is that we don't just take children with special needs or developmental delay or anything like that. We do have a lot of neurotypical children enrolled as well. So if, a kiddo is just struggling writing their name or struggling saying their R's, we still accept all of those clients too.
If they're struggling saying their R's, that would be terrible.
Especially in my family, right? That would be very difficult.
Dr. Davis.
Definitely. Feeding therapy. This is a big discipline that's been increasing the past couple years. This is one of our most famous, I would not say famous, our most requested therapies from our clients. So things like eating a balanced and healthy diet. A lot of picky eaters come to us. Their parents want them to expand their food repertoire. Decreased drooling is a big one. Controlling their tongue, lips, and cheeks. And then just having a positive mealtime experience. So some kiddos can't sit down for a full meal. They can't use utensils properly. They like to play with their food, instead of eat it. So feeding therapy can work on all of these things. Behavioral therapy, otherwise known as counseling. This focuses on techniques to help foster social, emotional, and behavioral development. Not only do we, service our clients, but we can also do this for families. So one thing I didn't mention is we do family and marriage counseling as well, which is part of our adult niche. But for the children, we can focus on all of the things listed here, such as disruptive behavior, ADHD, anxiety, anger management, problem solving, et cetera, et cetera.
And just to help the audience understand a little bit about the importance of the family interventions that you're doing, how does that impact the person's outcomes and well-being?
Yeah, so I actually do have a slide on this later, so I'll touch on it in a little bit here. But we think the collaborative approach is best. So if the client is a kiddo that's part of a family dynamic, their day-to-day is going to affect everyone else living in the home's day-to-day. So if you tackle everyone as a unit, the outcomes seem to be a lot more positive in the end. So for example, a special needs child can cause a lot of stress on a marriage. It can cause a lot of parenting differences or different opinions. It can cause financial stress. It can cause the sibling dynamic to be, unfortunate, such as, maybe one brother is getting therapy and the younger brother thinks that he's getting no attention because everyone just wants to play, is coming over to their house to do therapy with their sibling, but they look at it as play and they're getting all the attention. So that can cause the other child to have, outbursts and things like that. So there's a lot of different angles that the family dynamic is super important too.
It seems like such an important part of everything that goes on with people, and one that I think often gets ignored is trying to help families, deal with those relationships that develop in families.
Yeah.
So it's really a key thing. I'm glad to see that you offer that part of the service.
Yeah, no, it's super important. Like you said, I think a lot of parents, when you have a child, you don't think day one, oh, my kid's going to be in therapy, my kid's going to need help. So just even accepting that as a parent and being okay with that and, moving forward in a different direction that you didn't anticipate for is a huge struggle for a lot of the families that we work with. So definitely something important. As I mentioned earlier, kind of our signature is our mock rooms. So we believe that children need to be successful in all areas. We don't want them just to be successful at school and then have outbursts in the community, or just to be successful with mom and not be able to listen to their teacher. So we have these mock settings in all of our clinics, which are 2 in Illinois, Libertyville and Crystal Lake, and then 2 in Tennessee, Franklin and Clarksville, that we can practice these skills in a controlled environment. Where the kiddo can practice going to the dentist. So then when they actually go with their family, they're able to apply those skills in the natural environment. So we can desensitize them to any fears or any sensory, challenges that they need to overcome. Some of the mock rooms that we have are a restaurant, a dentist and a doctor's office, a hair salon, a nail salon, classrooms. We have a religious setting, so families that want to, have their child go to church with them or synagogue. We have a turf and an outdoor room. So this room, I don't have a picture of it on here, but it's actually super cool. So it's like a grass turf room, and we can practice, kids watching fireworks or, just sitting in the grass and being okay with that. Maybe bugs is a big trigger for them. So we can have pretend bugs flying around, things like that. Clothing store, grocery store, and library.
So these are all things that you're doing you've basically created these settings so that you can bring the kid in and have them go through the motions of dealing with that situation and working with them specifically in these types of situations. Is that what I'm understanding?
Yep, exactly. So for example, if a parent comes to us and says, every time I take my kiddo to Target, it's a meltdown. They don't want to try on any of the clothes. They just want to open the toys and play, then we can have them come to our clinics. We can have them practice trying on clothes in the clothing store. Different textures might be triggering them, things like that. So then they have the skill set to apply that in the natural environment with their families. So like you said, bringing it back to the families, it helps the family's quality of life because they're able to go to a restaurant as a family now because their child is able to practice that in a controlled therapy setting, which helps their, quality of life when they want to do it on the weekends.
And I see that you have a medical setting. Oh, am I seeing that correctly, or is that?
Yeah.
Yeah.
Yes, in the top left here is a dentist, mock dentist office. You can see like the light, and we have like the smocks and everything that they put over you at your dentist appointment with the bright light, so we can really practice all aspects of it.
Well, that's really great because dental and medical appointments are one of the most difficult things, even for a lot of adults. I think a lot of adults actually have been traumatized through their experiences in doctors' offices, dentists' offices, and the fact that you're working with them in this manner, I think, is tremendous. In really all of these different settings that you're talking about, but this is a real key.
Yeah,
piece of
we've had great feedback from our families too. Families have called us and said, they're so scared to go to their dentist appointment because it's just a meltdown. They need both parents to take off work. It's a full day, struggle, and they get anxiety leading up to that appointment. And, after coming to us and working on it for weeks leading up to that appointment, parents will call us and just be like, that was the best dentist appointment ever. We actually went out to celebrate afterwards. He loved it. He kept his mouth open. And a big piece of this is a lot of kids that have special needs don't get the proper treatment because they're not able to open their mouth for a dentist to see that they have a cavity, or they're not able to sit there to get their blood pressure taken. So those things go missed, which can lead to more problems later. So it is really cool that we're able to provide this for families.
Raquel, I was thinking about this through the experience I had yesterday of getting that monoclonal antibodies treatment, because that requires a needle to be inserted into your arm to be able to receive that treatment. And so many people that we serve might not be able to get that really, life-preserving treatment because they couldn't participate in it. So being able to offer people the opportunity to do that, I think is fantastic.
Yeah, and Bree, if you want to, I can't pull up the chat, but if you want to chat, like our Instagram and our Facebook page, we have many more pictures of our mock rooms. I just put like the 4 that I could find, but all of the ones I mentioned here, those are on our website and our, Instagram and Facebook. So feel free to check out, more pictures of the other settings too.
Yeah.
That's great.
And something that I really love about this too is that when you're having those direct therapy hours, there's so much content in our buildings that you can work on, and so much opportunity to practice transitions. And I've seen some really cool creative ways to work with children. For example, we can assign a new therapist for one of the days and pretend like knocking on the door, entering in, even it being an unfamiliar person that has a mask on, and then walking them through vital checks, right? I mean, it's pretty realistic in these rooms. So I love that about what we do.
It gives you the opportunity to practice repeatedly with it versus, just going for the one shot that you go, when you go somewhere in public, or you have to actually get the procedure done at your doctor's office.
And then mobile
trained. It's advanced. And so you use these rooms a lot. That's what I'm gathering from what you're saying.
Yes.
Yeah, I would say this is kind of like what makes us unique in our therapy space. We're not just a pediatric clinic that does speech and OT and ABA, but we have this part of our service model that really kind of expands it into the real life setting. So, it's one thing to be able to, imitate your therapist in a therapy room, but are you actually able to imitate them at a restaurant when you need to, sit down for a certain amount of time? Those kind of things, could overstimulate a child where, we can actually work on that. So then when they do go into the community, it's a positive experience for everyone involved.
That's superb. I love that part of this.
Yeah, thank you.
Can I ask a question? I know you said on the bottom of the slide the desensitization piece. So do you layer in, like, for example, with the restaurant, do you start to layer in some of the sensory experiences they're going to have with sound
Yep.
and other things kind of going on in the room as you progress through that?
Yeah, so we have each one of our clinics is a different theme. So, for example, one of them is like a pizza setting. So we'll have, TVs playing sports on in the background, so they're, seeing those sounds, or we'll have the clinking of the glasses, you know, playing in the background. So they're really getting the real experience. Something we do in the religious setting is a lot of music, loud music in those settings. The turf and outdoor room, that one's actually really cool. So I would suggest to go onto our social media to look at that. But, a lot of families want to go camping as a family. So we'll practice like setting up a tent and, having to sit on the ground and, playing in the dirt and things like that. So we really can do a lot with these mock rooms, which is super cool. And we do a lot of parent training. So not just with the kids, but we can set up a time where like mom can come and practice with the child too. So we can give them tips and tricks so they can apply it when they're with them alone. Any other questions about the mock rooms?
No, that's superb though. I love every aspect of that. That is it's great stuff.
Yeah, thank you. It is really, really nice. All right, so it's just a little bit more going into our staff. Every single one of our therapists are licensed and credentialed. We share, any information needed directly with the school districts, and we like to collaborate. So I know Bree touched on this collaboration piece. We believe that, we look at the child as a whole. We don't just look at them as this kid needs speech therapy. We'll look at every aspect of their life. So, how are they doing in school? How are they doing in the community? How are they doing at, soccer practice or at grandma's house? And we'll work on every piece of that. All of our therapists have background checks, fingerprinted, and proof of liability insurance. We do go into schools and daycares. So with that, there's obviously challenges. And, on the left side, we listed some challenges that we can support. And on the right side, you can see how we can support those. So I'll just go over some of these, but, kiddos that need services at school, like through their IEP and stuff, sometimes they're pulled from the class. So, if they have to leave the building to go to a therapy appointment or they have to leave the class, they're missing that time with their peers. So the cool part about MTC is we can go in and we can push into those classrooms. Each school district has their own rules about this, but the ones that do allow us in, it's beneficial for the child because we can just push into their class. We don't have to disrupt their day. We go to them. It's hard in rural areas to find services. So another cool thing about us is that we come to you once again. So it doesn't matter if you're, in the middle of a rural farm area or maybe a hard part of the city to get to. We can still come to you. I'm gonna keep going here. Parents. So a lot of parents. Oh, yep.
Just a quick question there. Have you been able to do that outreach to rural areas just because you say, okay, we'll travel there, or have you been able to find therapists within those rural settings to be able to serve people?
Yeah, so I think staffing has always been a struggle just across the therapy world. There's always a shortage. There's never enough, that is needed. But we have actually had great success in the rural areas. We found a lot of great staff. Bree, what's one of the cities that we just staffed that was kind of in the middle of nowhere? You would know better than I would.
Bon Aqua. That's an example of one I had to look up on a map.
Yeah, so we have a
Thompson Station.
Before, but where is that located? Is that?
It's about an hour outside of Franklin, west.
Oh, okay.
Yeah.
So we have a client there right now who is getting in-home services. They're getting ABA and speech therapy. Something we also do is telehealth. So I'll go over that in a little bit too. But families that may not have the resources to drive to us or that maybe don't feel comfortable with us going into their home, we can always do telehealth as well with them.
Raquel, we had a question in the chat box asking how far you travel. I'm assuming in Tennessee.
So right now we're servicing I believe it's 3 counties. Bree, correct me if I'm wrong, but it's Williamson, Rutherford, and Montgomery. Is that correct, Bree?
And Davidson.
And Davidson, so 4. So we're traveling to those 4 currently.
I think we're about to be in Wilson too. And then what we also do is, like, if we have a need like Bon Aqua, like we posted a job to recruit someone for that area.
Okay.
So that's where we're trying to serve the rural community, and we can also provide the telehealth too, if and when we're waiting for someone to get in that area.
Yeah, we're very open with any, potential enrollment that comes in. They go through a whole onboarding process, and we're very transparent, and we'll say right up front if we have staff in the area, if we still need to recruit, and we'll give them that timeline of, we could take you, but it might be 3 months because we have to recruit in your area. So we're open to that as long as families are willing to meet us halfway.
That's great.
Yeah, good questions. Parents. So we all know that, we go into this field to help the kids, but the parents are a piece of that. They're their guardians, or they're who they live with more time than they're with us. And they might have multiple kids, so scheduling is always a struggle. So we help them do all of that. We are pretty much open at all times, Monday through Friday, 7 to 7. We also do weekend appointments based on availability. We do have a lot of staff members that like to work weekends, so we match them with the families that like to have weekend sessions. We work with the school. We work with EI, which is in Illinois, and TEIS, and private practice as well. Currently, we do not have a waiting list at either of our locations. We have a lot of daytime openings currently that we can just accept, to start within the next 2 weeks. And then those after school time slots usually start within a month. So it's a little bit longer, but it's just because that's where the need is. Most kids are in school, so most therapy sessions are after school.
And if I can add in here too, something that was amazing, I think that MDC focuses on is, in my experience in Tennessee, a lot of parents, especially if they're rural, first off, they're not gonna be able to get services unless they're driving quite a bit, but the driving amount prevents them from getting all the services they may need. Because if they have to go to speech therapy for a half an hour in Franklin, and then they have a half an hour feeding therapy in town in Nashville. So this way we can offer more services because there's less drive time. And we found it very convenient for parents to let them be able to drop off their kid, know they're in good hands, and that there's a whole team working together to provide multiple therapies in different orders.
Yep. All right.
Good stuff. And I think that is such a huge issue because, just thinking about a lot of parents trying to get their kids back and forth to soccer practice and various other things that they're doing. But when you've got all these therapies that you've got to do, that's an extreme inconvenience, difficulty for parents. And I think it seems like you're really addressing that.
Yeah, and it prevents community integration. They might not have a night free to go to gymnastics or soccer. So,
Yeah. A big thing that we also support children in is getting an actual diagnosis. So we get a lot of young kiddos or new parents, young parents that they know something's not right, but they don't know what. So they'll call us and they'll come to us. We actually don't do any diagnosing ourselves, but we have connections and relationships with, people that can diagnose. So we'll connect them, we'll help them through the process. We'll tell them exactly, where they can go with what insurance they have. So we even help clients that we don't even take on. We'll help them get started with their journey into the therapy world. Let's see. Bree, what am I missing on this slide? I think that's pretty much it. We service all ages, so 2 through adulthood. We don't have a cap on severity level, so we have a lot of resources such as a safety team. We have a safety security specialist on site. All of our staff go through safety training. We have a safety hotline that our staff can call into, and parents. I think I hit it all, but
I think MDC's, I'm glad you talked about security. like right now I have my walkies right behind me, and there's just so much communication and support in that area, because if you can imagine the operation of having all these multidisciplinary areas within one building, there's a lot going on at times. So what I love is that we can have a prompt response to any safety concerns. I think that's really special. And I think, Raquel, you're going to touch on our screening, our free screening services, right?
Yep. So
There we go. The next slide.
yeah, I think, and this kind of ties into helping clients that aren't, or helping kids that are not even our clients. So we do offer free screenings and consultations. Parents can request this, at any time. We do mass screenings at schools. This only takes about 10 to 15 minutes, and it'll pretty much just give the parent a snapshot if we see any red flags or if they're not meeting any developmental milestones that they should be at their age. So we can do this in person or via tele. So some families during, COVID were, in the past year or so, a little bit nervous to do any type of therapy. So a lot of people moved to the telepractice model, which has shown to be successful. I have a future slide on that, so we'll get back to that. But we'll give the parents this report free of charge. It'll give them the results and any recommendations. We do not say that they have to come to us. So if, they have a family friend that owns a speech therapy clinic that they want to go to, or they, really had a great recommendation from a mom at school and they want to go somewhere else, that's totally fine. We do this free of charge, and we just think it's, a great thing to get a kid on that right track. So this is why we offer this aspect to our company. Any questions on this?
So I'm just curious, have you ever had a parent who kind of just came up for curiosity and then, got this free screening and then discovered that they really did have a service that they needed?
Yeah, so it actually happens all the time. I would say a lot of parents, and I don't know how to word this besides how I'm going to say it, but a lot of parents are in denial at first. They think that nothing is wrong. They may have never seen their child with other peers, so they don't know what to even compare them to. Or, they might be acting a certain way for them, but not with others. So they might not see the discrepancies. I think it happens, I would say about 75% of the time that we give a client or a parent a form that has a red flag and a recommendation. At first they say, oh no, we're good. We're not going to move forward. And 75% of the time we'll get a call back within the next 3 to 6 months saying that they changed their mind and that they want to move forward with services. So sometimes it's just about planting that seed, making parents aware that there might be something going on. And we believe, which is a future slide on here, that early intervention is key. And the quicker that you start something, the more success you'll have. So here is kind of like a snapshot of that. So we do our free screening and consultation. If they do have developmentally appropriate skills, we'll just give parents that suggestion of things that they can work on at home if they want to keep moving them along through developmental milestones. If we do have clinical concerns, we will give them that. We offer to rescreen them in 6 months. So if parents aren't ready to make a move there, or they want to research, or they want to look at other, get a second opinion, so be it. We offer a free rescreening in 6 months, and then, we'll give them our recommendations. Evaluations. So we do formal evaluations too. This happens after the screening. If we see, hey, we flagged this kid for speech, they have some speech delays, we can do a formal evaluation. This is, through insurance. We will check their benefits for them, which can be a pretty lengthy process for families, especially if they're busy or they've never done it before. So we do this free of charge as well. We assist in finding, assist in physician referral process. We discuss their options with them. Then they receive the evaluation. They're provided with the report, and then we discuss the plan and either start therapy or, they can take our report and go elsewhere. And then when they're in therapy, we have consistent communication between the home, the school, all the staff members. So some kiddos might receive 3 to 4 services with us. They have a team that they'll have, quarterly check-ins with. That's just at a minimum. Most of our kids have weekly check-ins with their whole team, which we believe is very beneficial. We update their treatment plan every 3 to 6 months. So, some kids make milestones quicker than others. So we want to keep this fresh. We don't want to wait too long to update treatment plans. And then parents have access to all of our daily notes. So anytime their kid has a session, they will receive, they have actually access online to this in real time, but they also receive a take-home note too with goals, progress, any suggestions that we have for them to work on at home.
Do you have a particular system that you use for electronic health record?
Yeah, so for speech therapy, occupational therapy, counseling, and physical therapy and feeding therapy, we use Therabill. Parents get a log into that and they can see all their stuff through there. And then for our ABA, we use Catalyst, which has all of their data collection and progress there.
Okay, thank you.
Yeah. So as I mentioned earlier, telehealth, it's actually been around since the early 70s. No one used it as much as during COVID. So I think COVID was a blessing in disguise in regards to this. A lot of people that, didn't want to go to therapy or didn't want to make the move actually, started to do it from home and saw benefits to it. Research shows that some clinical outcomes are the same as in-person, or they're the same as in-person sessions. It's more flexible. There's less cancellations. The parent and caregiver involvement is beneficial. They can listen in, they can see what their kid's working on, they can apply those same strategies the therapist is using during their everyday routine. And successful telesession, you definitely want to make it a routine. You don't want to just do it one time and be done. It works best with consistency, just like any kind of therapy. And it can even be interactive. So it doesn't have to be, I think there's a misconception of just, someone sitting in front of a screen, but we've done very interactive sessions where we're getting up with the children. We're asking them to go get an item and bring it to us in front of the screen. So movement breaks, yoga, coloring are some examples of things that we still do with them through the screen. And then safety.
Brought that up about the successful telesessions though, because I think that's actually the next iteration of telehealth is trying to figure out not just how you do it, but how you do it effectively. And this level of engagement, I think, seems like it's really important in the telehealth sessions you're doing.
Yes, definitely. I think in the past year, especially in the ABA field, and Bree, you can interrupt me on this one too, but BCBAs, we were never trained to use telepractice with our clients. We were always, informed hands-on is best, in-person is best with our, special needs kiddos. However, during COVID, we were forced to use this a little bit more, and it was actually surprising. I think a lot of people in our field were shocked to see that it worked so well. Some kids were actually opening up more to us over a screen, like comfortable in their own home, looking at us versus being, so close to us and so hands-on. So it is kind of interesting to see the actual success. I will be the first one to admit I was very hesitant to use it, and now I love it. I think it's awesome, and it works. It actually works really well.
In some sense, it's a way of fading your proximity from the person, because as you're working very closely with them, you're working a little less closely. And so they're able to develop more independence, it would seem.
And I think it's, sorry.
No, I just said exactly. Go ahead.
Oh, I was gonna say, it's also really helpful too when we mentioned getting out to our rural clients that we are able to still start a family with services, even if that's even weekly check-ins with the BCBA, to have someone to start collecting parents' concerns, if there's any parent training that can be done before someone gets on site. So we found that to be very useful too.
That's outstanding.
We had a few things going on in the chat box. Janet wants to know what kind of therapists are providing counseling. So I'm assuming qualifications or credentials there.
Yeah, so I'm actually not head of this department, so I wouldn't know. But Bree, if you want to pull up our website, I believe we have, MSWs, LCPCs. There's another one, but we have a variety.
Okay.
So if Bree, you just want to look that up really quick on our website, it should be on there.
And while you're doing that, Karen, I don't know if I'm going to say your last name right, Karen, but Karen Mavis has her hand raised, so I don't know if she wants to unmute and ask a question, if that was intentional.
No, it actually, I didn't see that I had my hand raised, but since I do am able to speak, I just was so excited about getting mobile therapy centers in Pathfinder because I checked and you guys aren't in it, and I'm sure a lot of people would want to connect with you. So I sent Raquel and Brianna um, the web address of Pathfinder, and if either one wants to send me their email, I can send them like step-by-step instructions. But it's on the homepage and it's pretty easy, and you can put any information pertinent in your listing.
Oh, awesome. Thank you.
Thank you.
Pathfinder is a service offered through Vanderbilt. It's basically a database of all the services that are offered throughout the state of Tennessee. And so any good agency like yours wants to be on that Pathfinder list because they will, parents, others will use that system to find providers.
So it was a good accidental hand raise.
Yeah, no, that's amazing. Thank you for that resource. That's really good to know. And then just moving right along, safety protocols. I know a lot of people, are with COVID. We comply with everything the CDC puts out there. We still maintain social distancing in our clinics. We have a cart. Every kiddo has a cleaning cart that follows them around. So, obviously when you work with kids, there's a lot of sneezing or, rubbing their nose and touching toys. So we make sure that we're very cautious with this. All of our staff wear PPE in the homes, in the community, and at our clinics. So not just one setting over the other. And then we monitor the wellness of our staff and clients every day. So everyone does a temperature check, answers a couple of questions, and before we're able to service them, just to make sure that we're all healthy. Community integration. So this is another piece that I think is cool about MTC. Not only do we just do, one-to-one therapy, but we have parent support groups. We have social skills groups. We do community events. We sponsor a lot of events in the areas. We volunteer. We do a bunch of outreach, and then parent education and teacher education. So to kind of touch on some of these things, I put Fall Fest and a puberty webinar as 2 examples here, because those are our current ones this month. The Fall Fest is across all of our clinics. We're doing kind of like a Halloween type event with games, face painting, pretend trick-or-treating, a bunch of, just fun stuff for the community. So you don't have to be a client to attend, anybody can. And then the puberty webinar, same with that. You don't have to be a client of ours to join this. We have a staff member doing webinars about puberty because it's a topic that a lot of parents struggle with their kids, but they don't really know who to go to and how to ask, and they might feel embarrassed. So these are some of the other things that we have offshoots on as a company. We have really good numbers come to our parent support groups. We offer this in person and remote. So once we added that remote option of tele, we had a huge jump in parents that actually came. So I think that is something super cool. And our social skills groups are every other Saturday. So a lot of our kids struggle with that social, picking up on social cues or how to play with a peer. So the fact that we offer this every other week is a great opportunity for those kids to join in when they can. Any questions on this kind of stuff?
I don't think so. We've got a few. Do we have some more chat questions, Michelle?
I don't believe so. I think the only one we may have missed earlier is someone asked if they had a professional support services license, or did they need one, or are they utilizing one to go into the home? A PSSL.
Is the question if we have it as a company, if we have that?
It says, do you need a professional support services license to go into the home?
No, so we don't need one of those to go in the home. We are considered medically necessary, so I've actually never heard of that, to be completely honest, so I'll look into it. But it is not the norm in our field, and Bree, interrupt me if I'm wrong.
Your answer is what I would agree with.
It's not required for behavior analysis services. It might be.
Yeah, I know it's not for ABA. It's the other that.
OT, PT,
Yeah.
SFP, those
I
a lot
I
of
bet-
people.
Yeah, I think that question's more related to adult services. Is that correct?
We know it's related to adult services. I don't know whether that applies to children or not.
Got it. Yeah, I'll look into it more.
Must be something to look into.
Yeah.
And let's see. So no other questions, Michelle?
I have a question.
Yeah, jump in.
I was going to put this in the chat, but I just decided to come off mute, Bruce, and ask. I wanted to know, with the social skills groups and things of that nature, did you say that those were for all ages as well?
So our social skill groups, we have a couple different, so we'll base them off of age ranges. So we have one for like 5 to 10-year-olds, and then we'll have one for like 10 to 15-year-olds. So then they can attend the appropriate age group that they fall into.
Okay, do you have them for adults as well?
Currently in Tennessee, we have not started that yet, but that is a 2022 goal of ours, is to start that for adults.
And you mentioned that anyone is welcome to participate in those. You mentioned that you didn't have to be a client to participate in some things.
Yeah, so you do not have to be a client to participate in parent support groups, in community events, or any of the educational, parent education, teacher education. Social skills groups, if you want it to be covered by insurance and whatnot, you have to be a client of ours. But we do offer out-of-pocket costs for that if you just want to do that and not be a client. So it is an option.
Okay, so do you accept anyone who might be with one of the 3 MCOs in our state, which would be AmeriGroup, United, and Blue Care?
Yep, we accept all 3 of those.
And my final question is, could you possibly send me if you have a slide with some bullet points about your services, how someone could go about getting in contact with you? I facilitate all Blue Care's behavioral advisory boards, and tomorrow we're having the TennCare Select Behavioral Advisory Board meeting, and I would like to share with them information about your service.
Yeah, I can even chat in here.
I've added your website or your email. I can put in our main website if you guys would like.
Yeah, so there's we have an email. It's just called asktheteam@mtcus.com. So Bree, if you want to type that in there for everybody.
Yeah.
So they can email that, and it'll connect you right with enrollment, who will get you started. You can also just call our number, ask to be connected to enrollment, and they can get that process started. Her name is Amy. So you can ask directly for Amy, and she does all of our onboarding. So she's your best bet of getting started.
Okay, thank you.
Yeah, no problem. And then I'll also send you, I don't know where to send it from here, so I might have to get information from Michelle.
I'll put my email address in the chat.
Okay, awesome.
Because if you do have something, I know it's short notice, but if you do have something that I can add to the overall PowerPoint that I'm going to have tomorrow, I'll be glad to put that in, because we do provide community resources.
Okay, awesome. Yeah, no, that'll be great. We'll definitely do that.
Thank you.
Yeah. And then just to kind of close out, and then we can kind of open the floor to everybody. As a reminder, we just really believe that early detection and appropriate intervention are the keys to achieving a child's greatest success. And then ongoing collaboration with families and educational teams allows us to achieve all of those goals. Here is our website, our direct phone number. We have a live chat feature on our website. And then there's the email that I talked about, Ask the Team. We also have Facebook and Instagram. You can message us on those. And you go look at more pictures of our buildings and some of the stuff that we do for the kids. So
Man.
hope you guys enjoyed, and I appreciated having the opportunity to share with you guys.
Well, thank you so much for being here, because this what a well-organized, great service you're offering. And I tell you, I'm really impressed with your mock rooms and how you're using those to really help people. I think that is fantastic and a good centerpiece for a lot of the things that you're offering. But your outreach to rural areas, very impressive. Your outreach to anybody who might need telehealth services. I mean, you basically got the whole package here, which is, I think, fantastic. So I just want to say thank you to RR and BD for being here today. Not myself, but Duncan.
Clever.
And so you guys are doing a fantastic job. Thank you so much for coming today.
Yeah, thank you, and to the great state of Tennessee for allowing us to help so many families. It's been a pleasure. We've loved expanding into Tennessee, so you guys are great.
Yeah. Well, and thank everybody for being here. This is the Clinical Consultation Network. As you know, we do this every Tuesday at 12:30. So be here again next week to join us for another fascinating episode of the Clinical Consultation Network. See y'all.
Bye, you guys.
Bye.
Thanks, Michelle. Thanks, Dr. Davis.